Mr. Gallick, how does the DEA define access to a controlled substance?
Chairwoman, I'm going to defer to my colleague here as the VHA team is working the details of the DEA waiver policy.
Yes, thank you. So the DEA definition of access to controlled substances includes anyone who dispenses or administers a controlled substance and anyone who has access or influence to how those controlled substances are administered or stored.
Mr. Bagdoyan, do you agree with that definition?
That's my general understanding that it is correct. It's access, dispensation, influence, proximity. It doesn't have to be direct access based on my understanding, but that is generally accurate, yes.
Thank you. And Mr. Gallick, are there VA employees who do not prescribe or dispense controlled substances but still have access to them according to the DEA's definition?
All right, again, I'm sorry, but I'll have to defer to my colleague to respond to that.
So yes, there are employees who do not dispense or administer, and those would be reviewed on an individual basis at each facility based on their procedures. This new review, based on the feedback that we got from the JO, is in our draft policy that we're working to roll out in January of this year to do the review that they recommended.
Thank you. Mr. Bagdoyan, under what circumstances would a VA employee who has access to controlled substances need a DEA employment waiver?
Yes, if they have a criminal history with a felony conviction for a controlled substance, and also they do not have a DEA registration, which would provide upfront sort of a dispensation that was considered. So those would be the two principal triggers. And of course, access is another issue as well, yeah,
Right.
or a consideration rather.
Gotcha. And Ms. Bongiorni, when was the last time the VA requested a DEA employment waiver?
We do not track that centrally under not having the policy in place yet that has been recommended, but under the new policy, any requests for a waiver would have to come all the way up to central office, and so we would be able to track those centrally, and they'd be reviewed at a national level.
Okay, so what is the, just out of curiosity, what is the biggest problem with doing these background checks? Is it, because we hear from other jobs that require background checks, and the length of time it takes to get them is one problem, but what do you think the hindrance is? Because I think maybe, in my personal opinion, everyone should have a background check who is directly related to care for our veterans. So what is the biggest problem with asking for and implementing background checks?
I would say staffing is definitely a consideration, but all of our adjudicators who perform the adjudication of the background investigation results that come from DCSA are trained in accordance with the standards and criteria for how to conduct a background or how to assess and the results of a background investigation. In terms of, I think the VA, we are committed to performing those background investigations consistently and properly so that we have good workforce. These particular instances that have been noted in the reports don't really have a good explanation for how some of these occurred. We're trying to improve our oversight and compliance to track those and to catch those instances where background investigations maybe were deficient or were not performed for whatever reason. Don't really have a good explanation as to why they occurred, but we're committed to ensuring that those types of events don't continue to occur in the future.
And several of you mentioned just staffing challenges with tracking, and what does the tracking process look like for during that hiring process, people that require background checks? Is it done on, is there an electronic system? Is it a paper? Or how are we actually charting who needs a background check, who's had one, where there are in that process? Is that adequate?
Right, so we haven't, as highlighted, we have the two primary systems right now, HR Smart, and also a new system, relatively new system, VA Cabs. We're moving towards VA Cabs being the one centralized system that captures all the data that's collected in the hiring process, the fingerprint results, the documentation that the application fills out related to the background investigation, and also the results of the DCSA investigation. Right now, we do have some of that information in HR Smart, which is our HR primary system for employee tracking, but we are moving all of that here in early 2024 to one system, VA CAPS.
Good. And then just out of curiosity, before I yield to Ranking Member Mervan, what is the security like in your pharmacies? Are there cameras on all medications, or is there especially security cameras on things like the opioid distribution machines? I know different hospital systems are set up differently. Sometimes the staff has to scan a card before they can have access to the machines. But, you know, for the medication to get in the machine, there's a lot of places where medication has to get from where it's manufactured into the building, into the pharmacy, into the distribution machine. So what is there adequate security? Are there cameras? Is there scanning of badges to know who comes in and out of the room and who has access to the machines? Or what does that security look like?
I'll ask my colleague to address that one.
So the detailed specifics are outside of my realm of expertise, but my understanding is that, yes, there are requirements for scanning in and out whenever we are dispensing or administering any controlled substances. And we have adequate control procedures in place with our pharmacy teams.
Are there cameras installed?
I would have to get back to you on that.
Just curious if that's a requirement or not.